Hi, this is Dr. Anderson from Anderson Podiatry Center, here to talk to you about coronavirus and measures we're taking to make sure that if you come in, you're going to be in a very safe environment, and also some screening questions we're going to be asking you as to whether or not you can come in. A lot of you have probably heard a lot of this, but I think it's a good thing for me to kind of review if you're wondering about coming in to see us at any of our locations. So first of all, I want to kind of reassure you that our offices are being cleaned down before patients come in, and then also at the end of the day. And obviously, if a patient's been in a treatment room, we clean those treatment rooms down before and after patients are going in those rooms. Countertops are being cleaned, and then before you even come in, we're going to ask some precautionary questions of you. Questions such as, are you ill right now? Are you coughing? Are you sneezing? Obviously, that would be a situation where we want you to stay home. Other questions would be, well, where have you been? Have you been traveling like in the last two months or 2 weeks? And especially if you've been overseas, that could also exempt you or not allow you to come in, I should say. Also, if maybe you've been to the state of California or New York or Washington State, that too would be considered maybe not a safe situation for you to come in because there's been a lot of coronavirus in those states. So those are kind of screening questions that we're going to be asking you. Also, if you're elderly and if you have other kinds of illnesses that might compromise your health, that would be another reason that you should just be staying home and be more quarantined rather than coming in to see us. And basically, a lot of emergency things problems we will be seeing you for. But if it's not an emergent issue, then probably it's better that you don't come in. If you're in the middle of a treatment program that we're going through, it kind of depends on a case-by-case basis, but many of you will continue through those treatment programs that we started, and we want to see you through to completion. Obviously, if you've had surgery, we're going to follow up on the surgery that you've had performed. And then I think to kind of cap it off, we're going to be having to reach out to you more rather than you having to come into us. And this kind of excites me because I've been doing this for a little bit of time with people that I treat with nerve conditions that are maybe overseas or in other states. And we do telemedicine, so we're going to be doing it a lot more with you locally. A lot of the restrictions of this, regulations per se, have been lifted. So it's going to be very easy. It may be as easy as just doing FaceTime on your cell phone, and we'll reach out to you. So if you're sitting at home having questions, maybe you have some condition you have some questions about, we really can do quite a bit and educate you quite a bit on the phone. It's nice to have you right there so we can put hands on you and examine everything, but it can be done by telemedicine. And I think that's something that you should consider doing if you have any questions. And but that's pretty much my update for now. And we may, if you have something real critical to know, we'll give you a little bit more information. Oh, and one more thing I might mention is that we are pretty much at a point of closing down our surgical center, just because, again, because of the state mandate. It's not for safety, but really any supplies that we have, it could come to a point where hospitals might need some of our supplies to take care of more critical cases at the hospitals. And most all that we do is elective surgery. So there could be just a very few couple examples of patients that I do procedures on with nerve that are more critical that maybe we can be doing those. We've checked with state officials regarding that. So, but pretty much almost everybody will not be having surgery until this is lifted. So I hope that was helpful to you. And hopefully we'll be seeing you in the future back in the clinic or possibly with telemedicine. And finally, we also will be reaching out to you and looking into doing home visits if the need arises. So thank you for watching and stay healthy.